I can't even remember how many times I got complimented on having good non-interview time. Your interviewing is not just when you're in front of the program director. It's also when we're sitting and just waiting for the interview to start or during breaks. So chat respectfully, professionally with fellow applicants. How are you doing? What city are you from? Make sure you're showing your best self, that you're not competitive, that you're friendly. Ask the program coordinator how long they've worked in the position, what they like about working here, what is their role in the program. That is so important to make sure that you're professional in thinking that you're in an interview. Think about if you were in person when you're walking to get a glass of water or walking to the bathroom, you're still on, like people are still watching you, people are still judging you if you're disrespectful or if you say something negative. Like people are always watching. Same thing on the cameras, people are always watching. So take advantage, use that as a positive for you when you're interviewing. Hello everyone, I'm so excited to do this interview with you. Now, why am I wearing my interview gear? It's because today we'll be going over the most important thing in the residency application, the interview part. If you haven't seen the first video that talks about all my tips for applications, now it is interview time. We'll be going over specifically how to prepare for the interviews, how to get those interviews. Once you submit your ERAS application, we'll be talking about what type of clothing, what type of background to do, how to use those breaks that they'll be giving you, how to collaborate, how to answer questions, and get the most important information from your interviews to make the best impression. We'll be going over how to contact different people in the interview stage, how to rank each program, how to listen to your gut feeling, all these things and more. So make sure you stay to the end. Make sure you're following. You even sign up for my practice interviews because I'll be giving specific advice to you. We'll be sitting one-to-one. I'll be doing practice questions with you for the first 30 minutes. And then the last 30 minutes, I'll be giving you specific advice regarding your background, your choice of clothing, your words, so you can really make the best impression. We'll be having practice interviews all for the month of October and November. So make sure you sign up on medpsychmoss.com. If you're going to have any virtual interviews, make sure you're practicing in front of a camera. Practice looking directly at the camera. You can have your picture right underneath. That's a great way. Or you can put a little smiley face or a picture of the dog under the camera. Those are great ways to make sure that you are talking to someone instead of looking down or looking. If you're reading, do not read your answers, but definitely prepare. Sometimes some of the things that I did, instead of having an answer verbatim, you can have bullet points of things that you want to cover. Now, look at what I'm wearing. I'm not wearing my typical MedPsych Moss gear. I went and grabbed one of my interview jackets from my residency. I grabbed even the same exact shirt. And now, if you look behind me, you'll be like, Stephanie, Dr. Moss, you moved. This is not your background. I even grabbed the picture of what my background looked like when I interviewed back last year. Yeah, exactly a year ago, back in this is 2024, back in 2023. Honestly, I liked my background. It wasn't as busy. Maybe I'll keep this for my future videos if it ends up looking good. Even though I have a beautiful view in my current place in the middle of the city of Chicago, this is more formal. So I'll be using my residency workbook that I created. I also gave advice on the previous video. We went through different worksheets regarding how to make the best personal statement, activities, how to talk about red flags, whether to dual apply. There's a video on going through 10 tips on dual applying, so check that video out too. So this time we'll specifically be talking about preparing for the interview. Let's talk about interview prep, going to my workbook. I started off by talking about how to prepare. One of the first things that I'm going to be doing to prepare for these interviews is I'm going to think about what I am looking for in a program. Now, in the perfect world, you would have thought about this while you're selecting which programs to apply to, but you don't have a lot of time, obviously. If you can do this before you select interviews, go ahead, do that. But I didn't have the time until after, or think about these questions after. If you're watching this in the future where you're applying to programs, yeah, you can think about this beforehand. So here's some things that I myself was looking for and hope maybe would help you. So some of the things I thought about is geographic area. Now, in the ERAS, if you looked, there was like 3 or 4 areas that you could pick, like Midwest, East, rural, like you can select those, but really think about it compared to just like selecting it for the ERAS. Really think about what's important about that area. Is there family? Do you have a partner? Is it a type of climate you like? Maybe you hate snow. Maybe you shouldn't choose places that have a lot of snow, the beach or summer. Like, think about those things. One of the big things that my husband and I, when we did this when applying to medical school, is we thought about nature, because nature, if you see my other videos, is really important for us. We're from Colorado, so we specifically looked for programs. This was back applying to medical school. Oh yeah, and this video is totally acceptable if you're applying to medical school too, or applying to any health program. These tips will help you. It was really important to have trails to hike and places to walk our dogs in, places to run, parks, things like that. Nature was really important to us. Okay, next, think about, and this was also back from the ERAS, do you want to be in big city? Do you want to be in the suburb, or do you want to be in rural? Or does it not matter to you? I know that part is for the ERAS, but it's something to think about when you apply. Some programs have transitioned to not all doing virtual. Sometimes they're providing the opportunity to go in person, either to interview or to have open houses. Take that opportunity if you have the finances, because it's really important to get to know the city, especially when you're ranking your programs. What does the city look like? If food is really important to you, do you have grocery stores nearby that fit like what types of food you want? Or if you're a big foodie like me and my husband, Chicago was big because of the food. You might not get that in rural areas where they only have big corporation or fast food. And what else? Maybe you like going to museums or theater. That's also 2 things that my husband and I really like doing. So again, big city. But I'm gonna say, like before, when we were from Colorado, all those things we didn't know. So be open. Talk to the residents in the program, talk to the medical students in the program, reach out, because you never know. A lot of stuff we learned about ourselves once we actually moved to the city that we didn't know were important to us, and now we know are super important to us. So think back to your experiences, connect with people in the area, family. All those are ways to determine what's important. Next, type of hospital. So what type of hospital? Are they big academic centers? Are they VA? Are they FHCC? That's one of mine that serves active duty recruits and veterans. FQHC, the community hospitals. Is it a private hospital, private clinic? So all these things you can think about. And I would say if you want to learn from that population, or if you want to work with that population in the future, for psychiatry, I specifically looked for programs that connected to a VA, because veterans, they are such a unique population. And even when I'm doing internal medicine, pretty much all my patients have a mental health condition. Even though I'm just focusing on internal medicine, mental health has a huge impact on the body. So I'm really glad I'm working at a hospital where I can focus on my patients' sleep and their PTSD and their anxiety, while also treating their health conditions. Religious affiliations is also something to think about. This was very big for family medicine, because sometimes when they're connected to a hospital, that doesn't allow you to see certain patients or do certain procedures, maybe doesn't allow you to prescribe birth control or a type of birth control. So definitely something to ask the program director, ask the residents, ask the attendings all during interview of, are you allowed to do birth control? Are you allowed to talk to your patients about birth control? Other questions is like political influence, especially in this year of politics. Some cities and states, you're not legally allowed to learn or even do certain procedures or work with certain types of patients or provide certain types of healthcare. Or maybe you're in a program that only takes care of people who have insurance, and maybe you want to work with people who don't have insurance, are underinsured, or Medicaid and Medicare. Now, you can find out by asking residents while you're interviewing, or you can look at their website, look at their social media page, and that's resident diversity. Diversity isn't just the color of your skin. It can be the religions that people practice. It can be, are all the people single, or do they have family, or are pregnant? These are some of the ways that you can figure out the different diversity. I'm going to give this example right now. I'm in a residency program that I'm the only female in my intern class. I had a medical student ask me not too long ago about the diversity. We laughed that, yeah, this year was really odd, and it wasn't the program's director. It was just how the match ended up that I was the only female, that based on my ranking, based on his ranking, it just ended up that way. So don't just look at the intern class, look at the past 4 years. Maybe if they have pictures, look at all the years, see if there's certain demographics or individuals that the program looks for. These are all things you can think about before the interview, because it makes it easier while asking residents and the school questions. These are also things that you can ask specifically. I'm not sure if this year they're going to do it, but last year when I was applying, they had really cool little dinners that were virtual dinners, some in person, that you could go and just with residents, talk to them, see, really get a feel for how they interact as colleagues, as friends. Do they even know each other? Is this the first time they've ever seen each other or talked? This is also where you can ask questions. I just edited my name down there. I'm going to edit my name one more time because it was important to me to include my pronouns when I was interviewing. Now, not all programs, that's something that's not that important to them. And so I wanted to be in a program that when I interviewed, they saw pronouns, that I was inclusive of sharing my own pronouns. And if I saw that other residents had the same thing, or other attendings, that told me a little bit about that program and their diversity and acceptance of others. It's so funny, these tiny tips, little things that if you're looking for and think about beforehand, it's easier to get a vibe. Obviously, in the moment when you're interviewing, there's a lot of other stuff you're thinking about. So take this opportunity to set up your Zoom account beforehand, of making sure your name's correct. Obviously, you wouldn't put MD unless you are an MD and applying second year, like in a transitional year, or if you're an IMG. Something that you can think about is like, what type of elective options are available? What type of electives are important to you? I'm going to use psychiatry and family medicine because those are the programs that I applied to. So for psychiatry, I was really interested in having electives in child and adolescent. Now, obviously, the ACGME, the accrediting body, requires that they have some sort of child and adolescent, but I wanted something very specific. I wanted an inpatient unit, or at least connected with an inpatient unit. I looked for programs that had women's reproductive mental health. I looked for programs that connected with jails and the judicial system, so I can learn how to interact with patients in that setting. What other electives were important to me? Some, they had an elective in substance use, like if they had a rehab program as part of their residency program versus just seeing patients with substance use in the clinic or inpatient. That was really important for me. What else? The LGBTQ, I really wanted a place that had an LGBTQ clinic because those are the patient population I want to do. For family medicine, I wanted a place that had a pelvic rehab program, so I could rotate at PM&R, or I could rotate with the PTs and DOs. Since I was an MD, I didn't have the opportunity, or just rotate with other DOs to learn osteopathic manipulation. I was looking for a residency that could provide me opportunities. Hopefully that was helpful. Fellowships. Now, some people ask why I think about fellowships if you're applying to residency. This is why. If your program has a fellowship, they most likely have an elective that you can rotate with the fellows. And so that makes it really helpful to determine if fellowship is for you and connect with the fellows program, connect with fellows. That way, eventually, if you apply to that fellowship, you maybe have an increased chance of staying in that program or getting an interview in that program. So thinking ahead, what other reasons are fellowships important? I'd say another thing is the variety of patients. If they have a fellowship, they see those types of patients. For example, in family medicine, if they have an endocrine fellowship, that means that they have enough patients that have more complicated endocrine diabetes. And so they're able to really work. And so you really learn the top information. So you can work with complicated patients or that specific niche. That's also a good way to develop a niche in residency. Find an elective or find a fellowship in your program. That way you can learn it. And if you learn that information, you might not need to do a fellowship. Next is opportunities for research. So it really depends on the type of research. Some programs are connected to an IRB, and so you're able to do more formal research. Some rural programs don't have that opportunity, so you're less likely to get your study reviewed and less chance of actually publishing in an academic journal. That being said, I've done a lot of publications that don't require an IRB, stuff like posters, articles about personal experience or patient examples, like case conferences. All those things are not formal research, but it's still research that advances my education and the education of other residents. So that might be an opportunity too, if you're interested. So I would say that research, you're going to usually academic centers. So places that have a huge hospital, that maybe have a medical school, that's what it means that they're an academic center. Usually they're in bigger cities, or they're called tertiary centers. They have a lot of specialists. Those are some ways you can find out. And also a great thing to ask during interviews is, are you a secondary? Are you a tertiary? Are you a community hospital? All those are different things that might be important for you. Next is patient demographics. This maybe you've talked about in your personal statement, saying that a specific patient population is something that you want to work with. And so looking at the community, maybe looking at the age demographics. Is it mostly older adults who live there, or is it more college students, or more military? Are you on a base? Are you in a VA? All these are different things that you can ask yourself. Are there immigrant populations, immigrants of a certain population or a certain language? Maybe if you yourself speak that language, that will maybe something that a residency would very much value, is if you speak the same language that the patients also speak. So that might be another way to increase the chances that you either get an interview or get matched, or they rank you highly in that program if you speak the same language or you're interested in their patient population. Another thing you can think about is it's important for you, for the residents, to have families that can be partners, a significant other, maybe having pets. All these are different questions that are great things to talk about during the night before or during the lunchtime when you're actually interviewing with residents. Ask them, do you have a partner, or is your partner in medicine? Do you have family nearby? Do you have a pet? All these are fun ways that residents can tell that you want to get to know them. And it also helps get a vibe for what types of residents do they have. time to even spend with their significant other or family or pets, or are they always working and always busy? Actually, I was just talking to a resident this morning. One of the questions that I asked the residents is if the get-togethers are open to just people in the residencies, or if the partner and pets are invited. It was really important for me because I noticed that there are residencies that the residents only hang out with each other, and it would be like a third wheel type situation if one of them invited their partner. And I didn't want that. I wanted to have a community of residents where I can invite my husband to partake in them, and so he can also become friends with. And so that was something that I asked in those meetings with residents. Are these events school sponsored, or can I invite my partners? Are they maybe family friendly? So seeing what they currently do, it shows what the culture is. So our residency this October, we all got tickets for the Chicago Botanic Gardens, and there's going to be 5 couples and then 3 people that are single. And so we're going to go to the botanical gardens, Halloween, pumpkin, jack-o'-lanterns to check out, and follow me on social media to see pictures from that. I need to get our program a better social media. So that is a fun activity versus maybe some programs, all they do is go out for drinks and alcohol. Not that's a bad thing, but it's something that's important to me and my husband, Dr. Moss, Dr. Jonah Moss, is that we do other things. In the summertime, we went with a group of his residents. We went on a boat. Yes, we went to boat swim. It was super fun, but those are the types of activities that are important to us and we're fun and we're outside, nature, loved it. Something to think about is medical students. Do you want there to be medical students? This is more likely if the program is academic, so connected to a medical school. Why is it important to know whether or not you want to have medical students at your program? So I think it comes to a lot of times yourself. Do you like mentorship? Do you like talking to students that are younger than you, people that are looking up to you? Do you like giving presentations to them, like making PowerPoints to teach others? It's okay if that's not your thing. Know that about you, and then look for programs that don't have that. Maybe you really want that one-to-one relationship with just your attending and not have to share with a medical student. That's okay. Maybe that's something that you can look for in a program, or ask residents if you always have medical students. I'm going to say, as a resident, even though we are connected to a medical school, not all the time do I have medical students that I'm teaching or working with me. For example, in internal medicine, we have various teams, and there are medical students, but not on my team. It's not something that I asked to be alone. They just didn't select medical students to be on our team. They're on other teams. In my substance use program, there were no medical students on it just that time. But I know for psychiatry, when I'm in my psychiatry rotation, I will very much have medical students, and it's something I'm very excited about. But again, that's me. It's just something to think about. Okay. Next, something to look for in a program, or to at least think about, is if they're DO, ING, LGBTQ plus friendly. Why is this important? Because if they haven't accepted someone of one of those things in the past, maybe you'll be the first one, and that's awesome. But maybe you have a higher chance if they've shown that they're more accepting, or more willing to interview people, or more willing to have them on their group, or place that those people feel safe. So some ways you can do that is their websites and see what types of people they are accepting. Or historically, some programs are very geared specifically to only DOs or only INGs. I don't think they're allowed to specifically do that, but it just happens that there's a majority of INGs or a majority of DOs. So it's something to look into, something you can also ask in interviews, or I say it a lot, reach out. I would be very surprised if a resident doesn't want to give you advice. Like, we were just there 1 or 2 years. Now, they maybe are too busy, that's something else, but see if you can reach out, or see if you can talk to people at your own medical school, see if they know anyone that went to a certain residency. Next, you can think about holidays and vacations. Something you can ask is like how they divvy up the holidays or vacations. Some places do 1 week at a time, 2 weeks, a full month at a time. So especially if you're thinking about coordinating with your partner's days off or coordinating with your family members, that might be important to you. I know that it was important for us because my husband, they do their holidays in 2 weeks. Mine only does 1 week at a time. So I then had to make sure that they aligned on the same week. And thankfully, I have a program that I asked beforehand. They care about this. And also, something I didn't even think about till now is like how nice the residents are willing to switch with each other for holidays, for religious holidays. I know, like in our residency, there are people who fast, so they don't want to be on 24-hour call, which is next during fasting, because that would make them very exhausting. So making sure that it is easy to switch with their co-resident, and that's something you can ask the residents while you're at those dinners or during lunch or prior. Length of shifts. Okay, so while applying to residency, I very much asked all my programs, do you do 24? And I put it in highlight. And this is a very complicated, no, it's not that complicated, but how do I want to say this? Some programs are moving away from 24s. Actually, the majority are, because they show how unhealthy it is. Just because they do it right now doesn't mean they won't in the future. Something to think about. And you can ask like, what does specifically 24-hour call look like? Maybe the program director, have they given other residents like shorter shifts? So like for our program, I actually asked my program director beforehand about 24-hour calls. And this is something we'll talk about a lot later in disclosing my health condition. And I think I did other videos on it too. But I was initially worried that I wouldn't be able to handle it. And so my program director said it would be totally okay to 12-hour shifts or 16-hour shifts. Now that I've actually done it, they're not as bad, just because my program, it's not like we're physically on call for 24 hours. We do our regular shift in the morning, and at 4 o'clock, we actually take over the page, and then it's all night till 7 a.m. We get to sleep. Not all programs allow you to sleep during it. And asking these questions, what does an on-call look like? Do you get to sleep, or are they too busy for you to sleep? Do you get a lot of crisis calls and have to adjust them? Do you have to endorse a lot of patients? What does it look like? Are you alone, or do you have an attending, or do you have a senior? These are all questions you can ask. I do another video about like my program's call, so you can check that one out. So like I said, they're 24-hour, but they're not 24-hour. And sometimes your day shifts are shorter. Maybe they're like 3 or 4 hours. So then it's more like 20-hour call. So all these things are things to think about beforehand. Time with patients. So this was something that was important for me because I know I'm a talker. I know I love to spend time with my patients. That's why I chose psychiatry. Family medicine in clinics, you don't have as much time, but some residencies, I remember there was one residency that still allowed residents to meet with their patients full 30 minutes. And that was huge. That was important to me. I ranked those specific programs higher. Yeah, those are clinic appointments, but maybe when you're on the floors, you have more time, and it's a lot based on how quick you are with writing notes, so you spend more time with patients. So if you're applying to surgery, time in the OR might be really important. I actually had a friend who did a neurosurgery residency, and the first year, she actually spent like almost no time in the OR. A lot of the time was on floors, and only the upper years got to be in the OR. So she didn't get a lot of OR experience, which was disappointing to her. So something to ask the residents or even the program director, I think actually more the residents, is like, how much time do you actually spend in the OR? Are you actually learning versus are you just being a med student and just holding? Psychiatry, we don't do that. We don't spend any time in the OR, but family medicine, Some programs have OR, like surgery time that you have to do, some don't. So something to ask about. Time in clinics, especially for internal medicine, this is really important for them. Some people really want to, even though it's an ACGME requirement that they have to have some time in clinic, maybe that's not something you want, or maybe you really want. So asking how much time, what year you start, sometimes they don't start into third or fourth year clinic versus as a first year. Okay, union. If you've been in the sphere of residency or interviewing, you will run into a program, at least one or two, that is actively unionizing or has tried to unionize or is thinking to unionize. Think about if that is important. Sometimes programs are so awesome that they don't need a union. Sometimes they need a union because programs are more willing to listen to them and their need. Unions can ask for not having 80-hour weeks, not having 24-hour call, maybe having better healthcare. So think about if it's important for you or it's something great to ask. I would recommend not asking the program director, not asking attending, because it's a very sore topic. Something that you can look online, social media, ask the residents. Wellness. Oh, this word is thrown around so much, and I felt every single interview, actually, I take that back. I was surprised when a residency program did not mention that word because it's so common for them to mention that word. Two ways. If they use wellness, ask, how do they have wellness? Do they have virtual didactics? Do they have set days where you can take a mental health day? Do they have days that they get together that the program pays for the residents to go eat? Do they provide snacks? Do they provide lunch during didactics? Do they provide a place that you can get mental health care as part of the program? I would say those are real wellness. Those are things that I would consider that a program is true wellness. So if you have a support system, whatever that means for you, whether if that is a partner, a friend, a family member, ask yourself if it's important for you to live or have a residency by that support system. I would highly recommend that you do. It's a great way to say, oh, I have XYZ support system. That's really important to me. This is the types of things that we like to do. It like brings in the component of wellness that you care about, your own mental wellness. Hello, this is the part 2 episode of the residency, how to make a great impression in interviews. Okay, I was also about to take a break myself, and that actually brings into let's talk about breaks. Thankfully, they will have breaks, or they should have breaks after every interview, every hour, every couple hours. If you require more breaks, after you receive that email back, it's pretty normal that people need breaks. You don't have to have a health condition. Whenever you receive like the schedule, if it's not in the necessary breaks that your body needs, you can ask for that. Hey, can I have a break every hour? You don't have to explain why. You don't even have to disclose. And if they say no, hey, that's a red flag. When the breaks actually happen, make sure you turn off your camera, go eat a snack, drink a cup of coffee, go to the bathroom, and then turn back your camera, sit there and talk to the people, talk to the program coordinator. That is huge. I can't even remember how many times I got complimented on having like good non-interview time. Your interviewing is not just when you're in front of the program director. It's also when we're sitting and just waiting for the interview to start or during breaks. So chat respectfully, professionally with fellow applicants. How are you doing? What city are you from? General, non-touchy, not politics, and just make sure you're showing your best self, that you're not competitive, that you're friendly. Ask the program coordinator how long they've worked in the position, what they like about working here, what is their role in the program, what types of questions do the residents normally ask them. So that is so important to make sure that you're professional in thinking that you're in an interview. Think about if you were in person, when you're walking to get a glass of water or walking to the bathroom, you're still on, like people are still watching you, people are still judging you if you're disrespectful, if you're mean, or if you say something negative. Like, people are always watching, same thing on the cameras, people are always watching. So take advantage, use that as a positive for you when you're interviewing. Okay, now it's time for me to take a break and to show very much how to do a break. So turning off my camera, which, let's just look for a second. You should see I have the exact same picture that's on my residency application. So make sure you have a nice professional picture. It still says my name. And then when I come back, I'm already sitting, I'm already here. I didn't stand up, not showing disrespectful things. If you're not wearing clothing, please wear clothing. I've heard, it never happened to me, but I've heard them do the Zoom check of stand up to make sure that you're actually wearing pants. Hasn't happened to me, but hey, could always happen, and they can ask, why not? Next, I'm gonna talk about the most common questions that you will receive in a residency interview. So these are the ones that you definitely want to practice. You can practice with me and sign up for my mock interviews at medpsychmoss.com, and definitely practice with someone. So here are the questions. 1, tell me about yourself. I feel like almost every single interviewer, that's how they started. Tell me about yourself, or I would like to learn more about you. Tell me more. That sort of idea. So one of the advice that I received once is, don't give your entire life story. Make sure all your answers are about 1-2 minutes. Focus on who you are as an individual, your values, focus on key points of who you are. Do not just restate your personal statement or restate your CV. This one, you really want to focus on you. I come from an immigrant background, or I come from this city, or I grew up in this town. You can add a sentence at the end of saying, oh, and I love these hobbies, or these are things that are important to me. Something that they'll have remember you. I gave this example for people who are doing their personal statements. I want to come away from that personal statement or from that interview and said, I remember that interviewee or that person, they're passionate about, they're the soccer player, or they're the person who is a caregiver for the elderly. They're the person who speaks Spanish, loves dogs, and took care of the homeless during COVID. Simple. I can't give examples right now off the top of my head, but this is who you are. Okay, next question, why you? Like, why should this program pick you? You should always give an example with a story. So every single question that they ask you, or almost all of them, it's helpful to tell a story. People remember stories. People won't remember the exact words you said, but they will remember the story or the emotion of what you said or how it made them feel. Same thing, they'll remember the conversation they had, the smile that you had, the way you made them feel. So how you answer a question, I like to think of it as a star. I'm using my workbook. S, describe a specific situation example. This is where you can pull in that patient example. T, task. What was the problem? What was the challenge or the thing that made you think? A, what action? What did you do to combat that problem or challenge? And then R, the results. What was the end? So we're not giving a full novel. It should just be almost like a statement for each. Describe the situation, the patient example. Describe quickly the problem, what you did, what happened, and then most important, the lesson you took away and how I'll use that as a future resident, as someone in their program, as a future doctor. So every single question, answer like a star. And so, like I talked about before, this is where you want to pull in those meaningful patient encounters. I like to have 3 patients or patient situations that were extremely meaningful to me, not the same one from your personal statement. Think of something else. Maybe think of something recently, maybe something that happened during your sub-I or an elective, something that shows a specific quality that demonstrates one of your strengths or one of your values. You can see a whole list of them in the workbook of different qualities like empathy, leadership, advocacy, emotional intelligence, respect, humility, curiosity, resilience, focusing on patient safety, trust, relationship building, critical thinking. You don't have to go out there and say, I was an advocate for this. You can say, I saw this patient, they were struggling. I went and talked to the patient after rounds, saw how they felt. I then brought it back. I then spoke with the social worker, and at the result, this patient received this extra support that they need. Boom. I was an advocate, and I hope to be an advocate for my future patients. Easy question that you should have: why this specialty? They all want to know why you chose this specialty. Now, this is where I'll give the tip that I like to schedule, especially since I was dual applying. I tried to all the same specialty in 1 week. So I was in the mindset of this week I'm talking about psychiatry. This week I'm talking about family medicine. So be very specific of why this specialty. Don't provide generalizations, whether if it's the types of patients they see, their day-to-day, an example of you working in clinic or in elective, a specific personal passion, an activity, something that connects you to that specialty. Okay, another common question is, what are you looking for in a residency program? So we talked about this earlier, all the things you thought about beforehand. Maybe this can even turn into a question of, turn the question around of, why did you choose to work here? Why did you choose to be a resident? Or why did you like this residency? Or what was your favorite aspect? It's a way to form that mutual connection. I always thought, for me, the interviews that were best were the ones that were more of a conversation instead of question, answer, question, answer. Another common question is, tell me about a challenging experience. It can be challenging experience with a patient, about an interpersonal conflict. It can be something in your academic record. Now, people who are interviewing you, not all of them receive your full academic record. It's usually just like the program director, maybe the associate program director, that have your MSPE transcripts. Most people that are interviewing you just have your personal statement, or maybe just have your meaningful activities, because they don't have time to read that for everyone. And they want to be less biased. So think about that. If you're being interviewed by one of the attendings that is not a high leadership residency role, don't bring up the red flags because they won't know them. So don't talk about your step failure or your leave of absence unless you want to, unless it's really important or something huge happened. But save that for the program director. They'll probably ask you about that. Be prepared. If you know you have red flags or things that could be seen as negative, practice giving a non-judgmental response that is calm, that shows that you've grown, that shows you've overcome that struggle, that you will use those lessons learned, those strengths, whenever something challenging happens in residency. Another common question that goes with, what are your challenges and weaknesses? Make sure you're not giving the general answer of, like, I work really hard, or I'm too detail oriented. Because obviously we want a detailed oriented person. We want someone who is hardworking. What's a good way to talk about this? Maybe a challenge that you can give an example of how you've grown from it. It doesn't say what are your current challenges and weaknesses. You can say what was a current challenge before and how you've grown over the past few years. That might be a good way to include it. I've talked about before the idea of being a team leader. When I was in college, I thought a team leader was the person who was the loudest, the person who everyone had to follow. I took that experience from being a martial arts instructor. Martial arts, there's a leadership like structure, and then through college, I've learned that a true leader is one who takes in everyone's opinions, who can step back and be a follower themselves, or doesn't have to be the loudest person in the room. So right there, I provided different ways of turning it into not a weakness, but like a challenge that I had, and how I became a stronger leader in the future. This will hopefully come up. What are your hobbies? What do you like to do outside of medicine? They want to see that you're not just about medicine. A true doctor and a true medical student takes care of their own health and wellness. They want to see that in residency. That's where you can bring in stuff of that specific area that you saw that There are museums, so say I love to see museums. Also talk about something that's real, don't make it up. That's why I was very specific on my background, because I wanted them to mention it. I wanted to talk about the bonsai and loving nature and outside, or also talk about my husband, because that's his bonsai plant. Or I wanted to talk about books. I specifically put all these books that I had a connection to. So like caregiving is right here. Right here is women's health. Down here, Brain on Fire is one of the first things that connected me to psychiatry. Body Keeps the Score, Psychiatry Vital Signs, reading about memoirs, the Obamas, leadership. So all these things, I had something to talk about, my hobbies, about my passions. The candle, the mountains, that I was from Colorado. So obviously you don't have to be as specific as me, but it was helpful to me. And also by seeing the picture of it behind me for the camera, it helped my mental health, helped me de-stress, to think the nature, relaxing. Also, I think about my husband. I guess this is a good time to also talk about the background. Do not have a bed that is specially unmade, but just the bed also looks unprofessional. Don't have your pets walking around, lock them in a room, or make sure you're in a different room, or have a dog sitter that day. What else? Make sure there's not a mess, empty dishes, clothing in the background. What other things that I've seen? Lighting, make sure you have. I had a light directly in my eyes, but I personally didn't like that you could see the circles of one of those lights. That's just me, but make sure you have nice, good lighting behind me. I got a lot of compliments of how equal the lighting was behind me. Let's see. My clothing, you don't have to wear a suit jacket. I sometimes didn't, but trying to be as professional as possible, which means I didn't have super low cut shirts. I didn't have very distracting earrings or very distracting makeup. Sometimes I decide to wear the same clothes as my ERAS pictures, so they would remember it. Oh, I saw her in person. Oh, I have the picture in front of me. If you look very different from your picture, that could be really weird. So make sure you have the same hairstyle. Don't be bald when you have hair. It would just be confusing. So everything, try to be as consistent as possible. See what you look like, do a practice video, see what it looks like behind you, see how your hair is, your clothing. Make sure it's not something that's too itchy. Hand placements, if you talk with your hands like me, make sure they're not too distracting. If you talk, I'm still using my hands, but they're down here, you don't see them. For me, I kept a hair tie, which could be very distracting. So make sure they don't see that you're playing with it, but it was important for me to help my own anxiety. I also had a stone that was helping me calm down, or I would play with it with my hand. But again, they wouldn't see it on camera. What other things? Personal connection. Do you have a personal connection to the program? So maybe you were born there. Maybe you went there as a person when you were younger. Maybe your family member works there. Maybe you have family support system. So if you didn't include that in your personal statement or in your ERAS, these are all great things that you can, when you send that email, to ask for an interview, or to thank them for the interview, or tell them that you ranked them super highly. Putting that last thing of, oh, I have my support system in, or this is my personal connection, that lets the program know, oh, this person is really willing and wants to be in our program and will rank us because they have that support system. I guess that brings into the concept of, when do you contact programs? Because there's all my videos, this is me, this is my own experience, my own ideas, my own research that I've done through talking to other residents, medical students, program directors. So on September 25th, that's when the programs get the huge list of all of the different people who applied to their program. And usually it's 1,000 or more. Now, it's a secret how program directors, they go through each of them. You can actually email them. I don't recommend to email them within that week or in that week after, because they're still in it, but you totally can. I waited, I think, till the very end of October. I waited until the first batch of emails went out to be a part of the second batch. Say, I hope you still consider me as part of your program, or still consider inviting me for an interview, or I still hope that you will have a chance to look at my personal statement. So it's really helpful to just, if they've seen your name before, whether on an email or if they've seen your name, you go to a conference and you remind them like, hey, I met you at this conference, or I met you at this meet and greet, or just the stuff that I mentioned earlier, what I'm looking for in a program. Maybe that's something that you can include in those emails. I'm looking for this specific research opportunity, and I know that this specific research physician works at your institution. Make it as personal as they can, make it short. They don't have a lot of time to read. I hope that is a good tip. So do it after they've sent their first batch, because maybe they were going to invite you anyway. Don't wait too long. So middle of October, great. You can wait till November to send a second email, or to send the first email, maybe to the programs that you're not as interested, but definitely October is the ones that you should submit, the ones that are on your high list. Sometimes if you have an update, so like maybe you just did step 2 and you passed it this time, and maybe you didn't pass it the first time. So emailing them to let them know, I passed step 2, or I just scored step 2, something that maybe was a barrier for them looking at your application before, or maybe a reason why they put you lower on the list, something that would maybe help. I remember I emailed them after I was accepted for a conference. And so I actually emailed them, hey, I was just accepted. I actually got first place in my poster. So that was something that I included in the email of saying, hey, I just got first place in IPS poster. And that got me an interview because it was interesting. It showed that I was passionate about Illinois, because it was Illinois psychiatric. Now, I did send this to family medicine. I do want to say that, just the psych programs. It showed that I was interested in research, and I sent them to the programs that I knew it was important. I hope that makes sense. I also have a link on my website on the residency guide that shows all of these questions, shows my actual Google spreadsheet that you can look at. And when I got interviews, I also shared the list of programs that I received interviews for, and how I ranked my gut feeling on the residents, the attendings, and the program director, because I interviewed with each big major group, and that's how I ranked it when I was interviewing. At the end of every single interview, I put down my thoughts, because they get very mixed together when you do multiple interviews, especially different specialties, different locations. And especially when you get to MAT ranking, it's hard to remember, how did I feel in that moment? Did I really love it? Did I just love it? Was it something that I got an icky feeling about? Write that down in a notebook and anywhere. That way it can really help you. And I also put that in the residency workbook that's on my website. The other questions are on my blog post, medpsychmoss.com. Some ideas you can have is have sticky notes on your computer, sticky notes on the camera to say, look here, or smile, dashes of the 10 activities you had, to remember whether or not you talked about that experience. You can do a quick patient example to remember, I want to talk about those 3 patient examples. If I didn't cover something, please comment below what your questions are. Sign up for the mock interviews so I can give you personal feedback and advice. Check out my other videos. I have an entire playlist on residency applications, how to talk about leave of absence, how to talk about disability disclosure. If you're a medical student preparing in the future, preparing for STEP, I have a section all about STEP exams. And you can also check online. I've shared my ERAS application. I've shared my personal statement. I've shared my responses to how I ranked the programs, different gut feelings I had. I also shared my husband, Dr. Jonah Moss. He is a neurology resident. He's a second year. He allowed me to share his personal statements, and he also shared the list of places he applied to. So check that out. That's everything. Thank you so much for listening in. Make sure you follow on YouTube or wherever you listen to this podcast at Life as a Patient Doctor. And thank you so much for being here today. Take care.